Hola, ¿qué tal? Bienvenidos todos a nuestro primer en vivo de Sporti Transforming Lives. Mi nombre es Sandra Carrera, soy fundadora de Sporti Transforming Lives, una asociación registrada como 501c3 en San Antonio, donde nuestro propósito es transformar la vida de niños y niñas a través del deporte. Y como pueden verme, me arranqué hablando en español, es mi primer idioma, soy de Monterrey. Y hoy nos acompaña la doctora Lucia Salas, que ella también, coincidimos, ella es ExaUDEM y coincidimos en San Antonio y nos va a compartir sobre la prevención de las enfermedades en épocas de frío, en el invierno, y los mitos en torno hacia el deporte. Este en vivo lo estamos haciendo y dedicando a todas las familias, padres y madres, que queremos educarles que a través del deporte se pueden transformar la vida de niños y niñas. Este fue, vamos a decir que mi introducción de ensayo. Ya está aquí la doctora Lucía y voy a tener que hacerlo ahora en inglés porque esta es una transmisión que vamos a tener grabada para compartirla con más padres de familia y más personas en su primer idioma. Hola Lucía, ¿cómo estás? Hi Lucy.
Hola, buenas noches. Muy bien, gracias. ¿Tú cómo estás, Sandra?
Muy bien, gracias. Aquí estaba conociendo a nuestros invitados, a quienes, todos los que nos están escuchando. Sé que es familia tuya, es parte de mi equipo de trabajo y compartiéndoles un poquito de, pues, quién soy y qué hacemos en Sporti. Pero, pues, vamos a darle formalidad a nuestro primer en vivo. Me voy a volver a presentar y presentarte, y lo haré en inglés. Y les agradezco también a todos los que nos acompañan ahorita esta paciencia en nuestra dinámica de arranque del primer en vivo. Lo estamos haciendo con mucho entusiasmo. Well.
Así es.
Hello, my name is Sandra Carrera. I'm founder at Sporti Transforming Lives. This is our first live, and we're going to have a weekly lives during the next weeks. And we're going to be promoting and educating through different experts, voices of experts, and how to transform children's lives. In Sporti Transforming Lives, that's our purpose, to facilitate education to parents and children and help them to become, to adopt healthier lifestyle habits in many, many, many different aspects with different experts. Join us in a weekly live and join us to learn more and transform a child's life, impact the family and the community surrounding him or her. Let me introduce today Lucia Salas. She's a physician, doctor, and she's joining us today to share all her experience around how to prevent illness and how to prevent disease in these times of cold and the weather when it's really cold. So Lucia, if you want to share with us a little bit of your experience, and then we can start having our conversation.
Yes, hello everybody. I'm Dr. Lucia Salas, and well, I'm a general practitioner, medical doctor. I graduated in University of Monterrey, or also known as UDEM. It's a private Catholic university in Monterrey, Mexico. And well, I have experience in so far, well, related with what we're doing today with patient education, as well as coordinating and doing medical brigades. I have been doing that since I was in early semesters in my career. Currently, I work here in San Antonio, Texas. I have been here for around 6 years now, and well, I work in the area of allergy and asthma, but I have also experience in the area of internal medicine, family practice, among other things.
Well, great to hear from Hello everyone, I'm back. How is Lucy also has a bad connection? Dr. Lucy, are you back? Now you're back.
Yes.
Okay, we both got a little disconnected for a minute. Okay, yes, thank you for sharing your experience, Dr. Lucia. Let's start into the topic. I hear really frequently from parents and caregivers that they're worried about their children, how to all these myths around, okay, it's outdoor, it's an exercise outdoors, it's really cold, and how can we educate the parents, the different myths of how to prevent those illness during the cold weather?
Yes. So for many years, we have been under the idea that if we have cold weather equals sickness, equals having a common cold, some influenza, respiratory viruses, and that's not true. That's totally a myth. So what we need to be aware of is that staying healthy during winter comes from the basic stuff that we hear often. One, eating well, sleeping well, and keeping yourself active. Like if we do that, if we are keeping our immune system the way it is. If we have underlying medical conditions like basal conditions like asthma, COPD, or any heart condition, it is important that we are very on top of using our medications the way it is indicated and do not skip those medicines if that's the case of some patients. And also we can also get vaccinated. We recommend that we don't miss our vaccinations, our vaccines. So if we have children that are younger than the age of 5, it is very important that they have all their vaccines there according to their age schedule. If the patients are older than 65, the same thing. These patients usually get pneumonia vaccines. So that's very important, the pneumococcal vaccines, to have them in place. And then the other thing for everybody, not this population, but for everybody, it's important that we get the flu vaccine. That will be our first line of defense during this winter. That's the most common disease we see. And now also we have to be vaccinated for COVID-19. And the people that have been vaccinated already against COVID-19 are wondering whether they should get the new a booster, the new bivalent dose. And the answer is yes. If you have received your last dose of COVID vaccine or booster or first series in the last 2 months, 2 months or more, like if you have received 2 months or more the last dose, you are due for the new version, the Omicron vaccine. Like everybody calls it like that, but it's not the Omicron vaccine. It's actually the bivalent booster. So it's very important because that vaccine, the plan with that vaccine is to get to protect the body against the strength or type of COVID we are expecting to see this winter. The same that's happened with the flu vaccine. You get a new one every year because it is done based on what statistics are saying is going to be the next strength to hit hard. Okay. So that's the recommendation.
And the recommendation in the vaccines, you have to be in a good health when you're going to take that vaccine, or you have to be just really feeling well, not any symptoms of any flu or any symptoms or allergies. Is that any condition that limits the application of the vaccine?
So if a person has either fever, shortness of breath, wheezing, it will be a no. Like a total no, it's the fever. Some patients can have minor common cold symptoms or having allergy symptoms. As long as the patient is not having fever, the person is not having fever, can have the vaccine. If you are at that moment diagnosed and currently sick with flu or COVID, you should wait 2 weeks to get at least 2 weeks to get the vaccine. So that's very important to keep in mind. But if you are having cough, runny nose, and no fever at all, go ahead and you can get the vaccine with no problem.
Okay. So coming back to the main question and the topic, in prevention and myths, how can we give some tips or suggestions to the parents I'm back. To prevent, How can we give tips and suggestions to the parents to prevent the children from getting any cold or any consequence of practicing in the outdoors when it's cold weather?
Okay. Yes, also when practicing sports, making sure that the attire is appropriate, that we don't put a lot of layers, because eventually when you're doing exercise, your body starts to heat normally. So if you use a lot of layers while exercising, then you're gonna start sweating more and more and more. And then after you're done exercising, there's no more layers to put on of clothing. So making sure, like, I'm not gonna say, okay, go ahead and do exercise in just a spaghetti strap t-shirt. Like, no, like use a light jacket, a sport jacket, making sure that type of a sport jacket is the one that has good transpiration, like be able to breathe properly. That way it doesn't get wet and soaked. And also making sure you have another layer to put on after you're done with exercise. So I mean, while you're exercising, just your one layer of clothing, like either long sleeve or a slim jacket. Once you're done with that, with exercise, put another layer of clothing to protect, and make sure you change your clothes. It's not like you're gonna get sick if you don't change them, but anyway, you're sweating, it's getting cold. So drastic changes of temperature makes the body a little more susceptible to lower defenses. And if your defense is lower, then you're more susceptible to getting sick if you get in touch with anybody that is sick. You're not gonna get sick because it's cold outside. You're gonna get sick because you're in contact with somebody sick. But if your immune system switches temperatures drastically, um, let's see.
Yes, I can hear you. Still here, Lucy?
Oh, okay, sorry.
I'm
So the
Mhm.
other thing we can do is making sure we wash our hands properly after doing sports and before, especially if we go to a place that we share equipment like balls, like basketball balls, volleyball balls, or if we go to a gym and we're touching the area, it means that because it's cold, this doesn't mean that we have to be not drinking plenty water. We're still losing fluid when we keep losing fluids when we're exercising, even though the weather is not hot. So proper hydration, it's indicated as well. And making sure that if we have a contagious disease, that we are contagious, that we're sick with flu or anything common cold, we make sure we don't get in touch with other people, like
Okay, I lost you again. I'm back in a new Wi-Fi. I'm sorry for all this disruption. And I was, can you just rephrase just the last part so we can have it in a recording about the layers? I was like, yes, in the layers, and just don't use a light jacket and then have a clean jacket to wear over yourself. Mm-hmm.
Yes, I mean, while you go home and change or go to the gym, the locker room and get changed, it's important that we don't stay with humid clothing. And also, it's important that we stay hydrated, even though it's not hot outside. We still lose fluids through sweat while exercising. So proper hydration, and also avoiding, if we're sick, avoiding contact sports with other people for a couple of days. I mean, while we recover, we take good rest. And if we're in a team that if we're sick with a viral infection that is contagious, of course, a common cold or a flu, that we strep throat, we stay home and do not put everybody else at risk to get sick. So we should rest for 1-3 days, depending of the onset of the disease. Just talk to your doctor and ask. And that way you don't put the rest of the team at risk, and try to do either rest or do solo sports, individual sports during those days. Then that way you recover strength, and then, well, you can go back to start, right? Being active the same way as before. And sneezing properly in our elbow, or coughing in our elbow in a disposable Kleenex to avoid spreading it to others. And I was also mentioning that it is very important that we wash our hands before and after exercising. But sometimes we don't think about that. But we are like playing basketball, soccer. We're touching the ball that we're playing with. We are touching. If we go to the gym, we're sharing. We're touching the equipment and sharing equipment in Pilates and stuff like that. Yoga also happens. So make sure that we wash our hands before and after to avoid the spreading of diseases.
Yes, well, now I think it's really clear your comments and your thoughts about how to just break all those myths that you get sick because you're practicing in the cold weather. You said it earlier. You get sick because somebody else, you got in contact with somebody else that is sick and it's like carrying the virus or the infection. So
Correct.
it's totally a myth that practicing an outdoor exercise in a cold weather, it's gonna make you ill.
Correct.
It's totally a
That's
myth. Okay.
yes.
But you
Correct.
have to use the proper gear, the proper clothing, stay hydrated, and keep and stay dry. Like if you all the sweat that you and the layers that you're using on our sweat, just change your clothing after your practice to clean and dry clothing, and then you go home, and then you take
Correct.
a bath, and you will be perfectly fine.
Yes,
Correct.
with no problem. Yes, being the fact that the weather is cold is not a limitation to exercise.
Yes, and it's not that cold. It's like probably it's over the 0 degrees. It's not totally like under 0. I know how do people live in Alaska and how do they are just walking outdoors. They're just with the proper clothing.
Yes, correct. Yes, that's right.
And thank you for sharing that. I'm just really into that we can practice sports year round, even though it's outdoors, and you just have to have the proper precautions, have your immune system. And that's my next question. How do you boost and how do you care in your meals, in your diet and daily intake to prepare yourself for the winter? I know that there's kind of different diets and different methods of how we prepare our bodies for each season, and I want to learn more about it. Can you share with that some
Yes.
your thoughts about
So So having a good intake of a balanced intake of protein, of having also a good balance of intake of fruits and vegetables, it's important. A lot of people think that, okay, it's winter time, just take some vitamin C over the counter and that's it. That's all you need. And that's not right. First of all, vitamin C that you buy in the pharmacy and you take it, anything that you don't use that day, your body just pours it out through the urine. So basically you're buying medication, sometimes some vitamins that you're putting in your mouth, digesting them and making your kidneys work harder and just put them out in your urine. You're just literally flushing that in the toilet. So sometimes it is a good aid if somebody doesn't have a good diet. But if you have a good diet, a balanced diet, you don't need to get those supplements. If you want it because you feel comfortable doing it, okay, go ahead, but it's not quite precisely necessary. Also, it's important that we take in consideration if the person that is buying these medications has medical conditions like acid reflux or GERD, any kind of medical conditions that kidney problems that cannot take certain supplements, because even though it's vitamins or supplements over the counter, they have effects in our body. Those have also, they need to be metabolized. So we put either effort on the liver or the kidney. So it is important to know that it's better to eat well than buying vitamins over the counter. So eating well, I will definitely advise to have a good intake of vitamin C naturally, having in your diet mandarins, lemons, limes, tomato. Sometimes we forget that not only citrus are the ones that are rich in vitamin C. Other fruits and other veggies are good in that. Vitamin D. Nowadays, we are seeing a lot of vitamin D deficiency, D as in David. So vitamin D is very important for our bone health, but also for fatigue, for defenses and the immune system. So we must stay on the sunlight 10 minutes daily to activate vitamin D that we eat. So make sure that exposing ourselves 10 minutes before noon or 10 minutes after 3-4 p.m. to the direct sunlight is really good for our body. Make sure like in the face to apply some sunblock just to be on the safer side, but 10 minutes of sunlight is what you need. Also eating well, like a good amount of protein, animal protein, if you eat animal meats is really good. Also broccoli, also corn tortillas, also spinaches are really good for this. To be honest, most of the people in the United States need some supplementation of vitamin D because we stay a lot of time indoors and we have a very poor diet. So it is very important that if we have a concern regarding this, we approach our doctors. That way we don't overtake vitamin D, but we're not also depleted. But so it's very important. And also a way to boost your immune system during this winter time is also by going easy on the amount of sugar, artificial sugar, or like processed sugar that we eat, because it is the holiday time and we usually tend to eat a lot of cakes, pastries, cookies, hot cocoa, among other foods are rich in processed sugars. And this consumption of processed food, of sugars per se, makes our body to work less than optimal. So we don't work that's in the immune system is not in the best conditions. And patients that are diabetic, also if the sugar is not controlled, like in persons who do not have diabetes, it is not good. But in persons that have diabetes, it's even worse because high blood sugar leads the body more prompt to get infected. So for infection, and it's important that we have that.
Oh, that's great topic to develop and also to learn more about the intake of sugar and the intake of, like, to boost your immune system. I'm trying to rephrase and just summarize what you said, is because we have just people joining recently that to boost your immune system, you're saying that we need to take vitamin C in natural form, not only from citrus like lime and oranges, also from tomatoes, and you said broccoli
veggies.
And veggies. And also the vitamin D to be exposed 10 minutes daily to the sunlight, noon sunlight, 12 or the 3 or 4 o'clock noon sunlight, with your sunscreen, but stay exposed to the 10 minutes of the sun, and you will get that vitamin D dose that we need to boost our immune system.
Correct.
That's great to hear. And well, I want to make a little pause and say and invite the guests as we have here that they can type in their questions, so I can start trying to rephrase the questions or order the questions for Dr. Lucia Salas, and because we want to share with you what you want to learn. We want to share the experience of Dr. Lucia Salas in this live to the community, and share what you are needing or what you are interested in learning. So share your questions in the chat, and I will go to the next question that we were thinking about or discussing. It's about what would be the main difference in allergies or flus or any viral disease?
So that question is often questioned. Sorry for being repetitive, but by patients and by people, right? We usually tend to say, "Oh, it's allergies," and sometimes we miss other symptoms. It's easier to just go and blame allergies, especially in San Antonio. That is it's very common. But we need to be aware that even though it could be allergies, it could be a viral infection. So the Biggest difference is going to be that usually with allergies, we feel itchiness in our nose, our ears, or our throat. And then when you take an allergy medication and antihistamine, like Allegra, Zyrtec, Claritin, once you take one of these medications, that itchiness reduces or goes away. But if you're having discomfort in the throat, and you're having even though you may kind of feel like a little bit of tickle sensation, and you take an allergy medication, an antihistamine medication, and does not go away, more likely it doesn't get any better. At least more likely it is a viral infection. If we are manifesting fever, and we have fever, more likely it's either flu or COVID, because in all of these conditions, we're going to see anyway some cough, some runny nose, so, and we can even see watery eyes. But the main difference will be that with fever, so with flu, we see fever. With COVID, we tend to see fever as well. And with allergies, we don't see fever, and it gets better. The symptoms get better with an anti-allergy medication.
Okay.
So that's very, very important to keep in mind.
And how do you address parents that are concerned about their kids' allergies and also the outdoor, exposed to the outdoor or exercising? I can share in my personal experience, my son, Diego, he had, since he was really a baby, 2 years, 3 years, he had a lot of allergies diagnosed. And we were always working with the doctors and the medications and all the treatments for him. But we were also always pushing him to play. And he was practicing soccer at a young age. He started practicing at 7 years old, even though we treated him from the very young to the allergies. But he grew with that. He grew with the allergies and managing the exposure to that allergies, because it was late, like when he was 12, that we discovered that he was allergic to the grass, and he was practicing soccer from since he was 7 years old to 12. But all those years, even though he was treated, the precise diagnosis of the grass being something that was increasing his allergies, the specialist told us he just made himself immune to it because of the exposure. And this is something that I know it's really difficult to discuss, and every patient is different. But I want to address it in your perspective as a doctor, how to promote an option for parents that their children have allergies and their children want to practice a sport that it's involving that environment that maybe it's allergic to him, but he can maybe decide to practice it because it's going to make him in the future immune to it. It's very complicated, but I wanted to share the experience as a mom that I lived with my son.
So what you said is right. I like a lot that you mentioned that every patient is different. So what I'm going to say does not apply like general to everybody. Every case should be seen as individual. But for sure, having an allergy, an environmental allergy to grass, to weeds, to pollens, to trees, should not be a reason not to do sports, not to practice sports. The best would be to, if we're concerned about allergies, to get seen by an allergy office, by an allergist, and do a proper testing to confirm that it's actually allergies what we're facing, what the patient is facing. Once the diagnosis is done, then the proper measures can be given in a specific, and also the proper treatment, because it can be as mild as maybe allergy medications, or maybe it's going to be allergy shots to be less allergic. We don't know. The case depends on many factors. But first, to identify, early identification of the problem, it's really good. And then we work around it. We don't avoid, in this case, talking about environmental allergies, is not like avoidance when we can work around initially. severe cases maybe, but initially most patients are able to do outdoor sports by proper management. Overall, in general, I would like to say that it's very important that we're very conscious that we, depending on how the allergies manifest, we most of the times it is like in the skin or runny nose. So let's say that if a person is very, very allergic and can wear a mask when being outdoors doing sports, it's okay to use a light mask. That way the person doesn't inhale all the pollens. And if it's adequate, the patient reacts with the skin manifestations, to use long sleeves, long pants. So we have a lot of kids that we see a lot of patients, pardon me, there are a lot of kids with atopic dermatitis or eczema. And one of the things is as soon as they get in touch with the grass, they flare up with rashes in their skin. So it's easier just to put long sleeve, long pants, protecting the skin from the contact. Also to be aware, and this applies for everybody that has allergies to the plants and grasses, that once you are done with doing exercising outdoors, try to change the shoes and leave them out in the entrance or outdoors. Do not bring them in home, because then you bring all that pollen in your shoes all around the house. So you are not just leaving the pollen outside, you're bringing it in to your bedroom, your living room, anywhere. So being conscious about the shoes carry that. Be conscious about the fact that it's important to vacuum the car as well, because when you get into the car, you get in the pollen. So just be, not to be obsessed about it, just to be conscious about doing it frequently. And also about changing our clothing after we have done, that person is doing outdoor sports, outdoor sports. All those pollens probably are in the clothing as well, in the arms and all that. So with kids and adult supplies, once you arrive home or before you go home, change the clothes. And once you arrive home, especially with kids, it's very important to get a quick shower, to rinse off those pollens. Because let's say, imagine that a kid is outdoors playing soccer. That kid is already in the field playing, falls down, grabs the ball, interacts with other kids, has been in the grass, kicking and all that. Then goes home and walks around with the same clothing, lays in the couch to watch TV, gets in the table to have dinner, then goes to bed, even though puts pajamas, all the pollen's already in the body. So you're bringing that, and now all night you're going to be breathing those pollens, so it can aggravate the allergies. In most cases also that have certain levels of allergies, the patients, what we recommend is to take an extra dose of allergy medication before doing a sports, to minimize or reduce the manifestation of symptoms. But it sounds very simple, but it's a big difference about taking a shower and changing clothing before we start getting into our beds or the couch at home.
Yes, it's just it's the small daily habits that you change to make big changes in your life and benefit from all. I totally confirm that saying. It's something that I have in my mind. It's just small changes that can make big changes in your life.
And in the bright side, it does not implicate any extra to the body. It's not like you're taking medicines, you're not metabolizing things from the outside. You don't have to be investing time or money on medication with this type of measures. And also, like if one member of the family is allergic, this measure should be applied for the rest members of the family as well, to help that one that has this problem of allergies. And the same happen often with asthma. People think that, oh, you're asthmatic, you cannot exercise. No, that's not true. If you're asthmatic, see your physician, talk about that concern, and depending on the severity, the type, the form, indications will be given to be able to continue physical activity, individual, in group, outdoors, indoors, adequately. It is not about getting into a bubble.
Yes, we have a player. She's young, she's 7 years, and she's been in Sporti 2 years, and she has asthma, and she said to us in an interview, her mom and herself, Alexandra, she mentioned that she's really happy at being at Sporti, and it has helped her grow her confidence. And as well, she said the doctor has it has helped me a lot with my asthma, and the doctor says it's really helpful for me and for my lungs. That's just like her words. It's really
Yeah, and also, definitely, and also the persons who have diabetes is like sometimes patients who are diabetic limit themselves from exercising because they're afraid to get like low blood sugar, and that's also not a reason to stop. Like there's no way to justify a physical activity through this. It's about working around with proper guidance, but not stop physical activity or daily activities because of a medical condition. There are always alternatives and options.
Yes, yes, and that leads me to a question about the daily habits in a dietary, in the meal plans, and how you can change also your condition, health condition, changing your healthy intake and your meal plans. Do you agree on that?
Yes, definitely. One thing that we're seeing a lot lately in the medicine area, it's fatty liver. Fatty liver is very common in everybody who has overweight or obesity. So all the ones that we have certain level of either or, more likely we have fatty liver. It will be almost impossible not to have. And the problem is that fatty liver eventually can turn into cirrhosis of the liver and then into cancer, liver cancer. So it's very important that we are aware, okay, like how this impacts in, even though you look fine, you feel fine, you don't have any other condition. So if the person loses 10% of the weight, more likely that fatty tissue will go, sorry, that fatty liver will go away and will reduce at least. So the best way to reduce fatty liver is by doing adequate diet and also exercising. So this combination, it helps a lot in health. That's one example. Diabetes is another example. So sometimes we don't think it had the big impact that it can have, but most medical conditions that we hear often, like hypertension, high blood pressure, fatty liver, diabetes, if we use a combination of diet and exercise, more likely we're going to reduce the medical condition. Also, people who has pre-diabetes, usually by losing 10% of their weight, they will improve or the pre-diabetes or even go back to normal and not be pre-diabetic anymore.
Okay. Well, that's something really, for me, it's like alarming, because I've been in all the program, and why Sporti started is that we we see the numbers, we see the stats of the children, and the numbers are alarming. It's 15.5%, the number of the percentage of children 4 to 15 considered obese or overweight. And you're saying that this can lead them to fatty liver, and fatty liver can lead them to cancer and other diseases that are just totally really bad conditions for our health. So we really want to educate through this kind of Zooms and lives. We want to educate the new generation, the children, the parents of the new generation, to instill changes, big changes that can transform their lives. We are convinced that by educating, and I am convinced with all my organization, that I can just bring this seed and start bringing in the seed of let's transform daily habits into healthy lifestyle habits. Let's make small changes. What about, I heard it earlier, that just one corn tortilla that we reduce from our daily intake, one less. If you eat 5, you will eat 4. If you want to eat quesadillas, you will take 3 quesadillas in the morning, then you will have your meal plan at your lunchtime without tortilla, and then you have 1 in your dinner. But instead of 5 in the day, you get 4, 1 less. It will impact 15 pounds in a year. You will lose 15 pounds in a year with 1 less tortilla. And I want to learn more of those kind of examples, and I want to share more of those kind of examples to our community of parents, so they can instill healthy lifestyle habits in the new generations. You said it earlier, like this time of the year that we eat a lot of sugar and added sugars. Well, let's reduce it. Instead of having the Marathon Reyes y tamales from Guadalupe Reyes to the tamales, let's start reducing the amount of candy, sugar, and added sugars that we have this winter season.
Yes, and also it's important to like just talking about something very superficial, the aesthetic point of view of things. Eating a lot of that type of sugar, those carbs, leads more to acne. So sometimes we're like, oh my God, like don't eat avocado, don't eat peanuts because you're gonna break in acne. That's a myth. What it will make you break in acne is artificial or in processed sugars and food. So no like reducing cakes and cookies, and probably if you start like people who tends to break in acne, and you wonder, oh, why do I have this pimple now? Think about what you ate 1 day or 2 days before, and probably you were drinking soda or maybe having a cake or having some like a hamburger fast food, but probably you had some additional sugar than more, and that's why you're breaking in acne. Sugar is one of the main reasons why acne flares up. So definitely that's another thing to take in consideration about acne and how the sugar plays an important role on it. And as you were mentioning, there are many examples. Also talking about kids, it's not the same to be an obese adult that was a healthy kid than being an obese kid and then also an obese adult. Because what happened is that when a kid starts to it gets obese, the fatty cells in the body, instead of just increasing in size, a kid that is getting obese, they're producing more adipose cells. So that person is going to have harder time getting to a normal weight as a young adult or as an adult, because that person doesn't have only more fat, has more fat cells in the body, compared to a person that has a normal weight as a kid, and let's say after menopause this person gets obesity. That person is more likely to lose weight because that person doesn't have more fatty cells. That person only has more fat in those cells. So it's easier just to reduce the amount of the size of the fat that you have inside a cell than reducing all the fat of a lot of cells. So it's very dangerous to be obese as a kid. And I know it's not easy, especially in a country like United States, that it's very easy to be sedentary. It's very easy to fall into fast food, where healthy food is way more expensive than healthy food. Healthy food is way more expensive than the other type of junk food that we see. So, but it's very important to avoid obesity during the children's life. I think that parents should always provide healthy food, healthy meals, and try to put everything in place for the kids to have a healthy weight. Then once the kid gets to be an adult, it's up to the kid to decide what kind of habits wants to have. But I think it is important and it's fair that a kid receives the opportunity to be a healthy kid. And then, well, as an adult, then everybody's on. It's a self decision, but definitely parents should try to give opportunities to be healthy, eating healthy, being active, and all that. Yes, I think it's very important because the impact as an adult is very, very bad. When a kid is obese, as an adult has a higher risk of many things. So.
Yes, has a higher risk to develop a lot of diseases when he's an adult, and more likely to have like diseases that can also shorten or his life, like just he will not live longer than 30, 35 or 40s. He will be really a kid that grows with obesity will be an adult with a lot of disease. And his life will be shortened. 30s, 40s, he will be with a lot of problems, liver, heart, or lungs, or a lot of disease.
Yeah. And even knee problems. A lot of people will have knee problems, and knee pain or feet pain is because of the obesity.
Yes.
as well.
And I just believe it's a vicious cycle. And you said it. It's sedentary activity, sedentarism, because kids spend 7 hours daily in front of screens. That's an average. They are sedentary children. They don't, the weather is also an issue. Like, no, it's too hot, it's too cold, so they prefer to stay indoors. And parents also prefer to have the children indoors and just inactive. And it's easier sometimes to just, okay, here's my phone, just play with it, or here's the candy, so you don't do any berrinches. So tantrums. And what we are promoting through Sporti, we want to educate parents that it's possible to promote health lifestyle habits and for children, so they can grow as adults, as healthy adults.
And
And
talking about, oh, sorry, go ahead, pardon me.
yes, I just want to, like, that's my purpose. That's my eager heart wants to share all this information with the community and with the parents. And we have a question regarding the topic. It's Diana Salas saying, is there any sport that you recommend the most to practice in specific during winter to keep our defenses strong?
Any sport. There's no limitation on one type, or there's no sport that will give more benefits during the winter than others. So any kind of a sport is good. And remembering that a combination of weights and cardiovascular exercise is optimal, and that applies in winter or any time of the year. Also, one of the things that I wanted to say that I forgot to mention earlier is that sometimes we are wondering about babies, what to do with babies. Like, can we exercise with toddlers and infants? Can we get them outside in the stroller if we're gonna go for a walk or run? Yes. The only thing you need to do is to make sure they tolerate cold weather. Is just one more layer than an adult. So a baby, that's all the baby needs, one more layer. So if you're wearing a sweater on top of a jacket, just make sure you give an extra layer to the baby of clothing, and that's it. They are not limited to be and stay indoors. They can be outdoors too. And also breathing oxygen outdoors that is healthy. We tend to be indoors with the heat on a lot, but also we need fresh air. So even though it's just a walk, not heavy exercising, just a walk is important to also do it during this winter time. And that prevents depression, because during winter we see depression. And one of the main things to do to avoid depression or reduce depression, and it's exercise. Exercise is proved as part of therapy, right? So exercising will lead to cope. We hear a lot that elderly die a lot during winter time, and it's not only because of respiratory infections, it's also because depression, because the winter weather tends to put us a little bit more depressive, more into a mood that we don't want to do a lot of stuff. So keeping ourselves active activates a lot of brain substances, a lot of neurotransmitters, and that will lead to prevention of depression or part of the treatment for it.
Yes. Yes, and that leads me to another comment that I want to share about how much time is it recommended to exercise just to be healthy? What is in a kid and in a toddler, in a kid and in an adult, what is the time to just, okay, let's start becoming a movement. Let's be active 10 minutes, 20 minutes. How much time do you have to be active and moving to be healthier?
30 minutes, 3 times a week. That will be the minimum. The optimal, at least 30 minutes, 5 times a week. Like, of course, if from 30 minutes and up, you want to exercise 1 hour, 2 hours, that's fine. That's really good. But the standard will be minimum 3 times a week during 30 minutes. Any exercise that is done beyond 30 minutes will give the benefits to the body. Also, saying, oh, I'm very active because I walk to my school, I don't take the bus. Oh, I'm very active at work because I'm putting stuff in shelves. That doesn't count as exercise. It has to be something outside of your regular daily activity. So the type of work that you do on your daily basis, it doesn't put you to say, okay, that with that I'm just healthy enough. It has to be an outside activity of that traditional daily work activity. So people who work like cleaning homes or who work in construction, yes, they are in a lot of physical activity, but at some point that becomes the normal for the body. So it has to be a separate activity where they are pushing their bodies and their heart beat as well to make it an actual full exercise.
And what would you recommend, like for additional, if you have, okay, my goal is to lose weight, what would be that extra exercise or that extra amount of time so you can just benefit from your exercise to lose weight?
At least 30 minutes. Everything after 20 minutes of exercising, any of cardio exercise to lose weight has to be a good combination of cardio and weight exercise. But cardiovascular exercise is the one that will make the fat to be burned, right? It gets transformed into sugar in the body, and that's how we use it in our body, and we lose that fat. So anything beyond 20 minutes will start helping to lose weight. So it will be the same 30 minutes, 3 times a week as minimum. The person will see better results by doing more. And the reason why I say a good combination with weights is because you don't want to lose weight and then be flappy and all like loose. So it is important that we put a strength, exactly. We put a strength in the muscles also for the muscles to be toned and have a better aspect, but also to conserve and preserve muscle mass, because losing weight is not about just losing a less number in the scale. It's also about preserving the muscle mass that we have. It's also
well, we have talked about a lot of topics. We have covered a lot of myths and unveiled myths. And thank you, Dr. Lucia. I want to open the microphones if we have any other questions. In the chat, it was just the one that I asked earlier. And do anyone wants to ask a specific question for children, how to prevent? You covered a lot of questions and myths that parents can be concerned. I appreciate it. And also from the notes that we did, we have covered all our questions. I think that we can close, if nobody's raising hands, we can close with just closing with the three, like what would be your 3 main tips, like Lucy tips? Oh, no, I have somebody raising hands. I found it. Diana Jaime. Okay, let me open the microphone for Diana. Okay, Diana, open your microphone and ask your question. You can also open your camera, Diana.
probably
Sorry. Yeah,
Yeah.
it's because I'm driving.
Okay.
Okay. I'm parking right now.
no, it's
Okay. Well, is there any sport that you will recommend the most to practice in specific during the winter, or to keep our defenses like more strong during this cold time, or all sports are good?
all sports are good. There's nothing specific for winter time. Yes.
Okay. Thank you.
Okay. Okay, we're back with Lucy.
I just want to ask if there's what's the best exercise or the best the best way of conserving the muscle in adults, please.
So it will be regular weights and gym equipment that you put weight on it for the legs, for the arms, for the back. That's the best way. And then in elderly, Tai Chi is one type of exercise that helps a lot and prevents osteoporosis as well. And in adults and also in kids, they can benefit a lot from yoga and Pilates because you're exercising with your own weight body, your own weight of your own body. So that helps a lot too. So that's very, very important to preserve muscle mass and also avoid skipping meals. If we skip meals, we start losing muscle mass.
Okay, thank you very much.
Okay, any other questions that want to raise hands here? Well, I was saying, well, meanwhile, they get the courage to raise their hands. I wanted to hear the 3 tips. We'll leave one more question after this, but the 3 tips that Dr. Lucy Salas wants to share with the community of parents that want to educate their children in healthier lifestyle habits.
Okay, so first will be start exercising or start sports at an early age, because at the beginning it's like a game for like a play, part of the daily play of the kid, and then that transform into a habit in a very easy way, compared to if we want to start once the kid is already a teenager or a older kid. So the younger we start, the better. Also, I will also recommend doing sports all year round, to also try to listen to the kids about what sport they like and which one they don't. There are plenty of sports. It's unbelievable the amount of options that we have. So even though they are kids, let's try to be a little bit less like authoritarian and say you do this and that's it. No, if there's a reason why a kid doesn't want a sport, let's look for another one, but also make sure that you keep consistency. So it is okay, let's listen, but let's not be that flexible. I think that's very important, to find a point in common that the kid is engaged in being active, and also to take in consideration always including a kid in a group sport, or doing it in a place that they're going to be in groups. So it can be soccer, baseball, something like that, or it can be something like that is even indoors, like ballet or dancing, other type of dancing, or it can be something like swimming if we like, even though ballet and swimming is a little bit more individual, that is not like a team sport, you're in a group. And when you practice that as a kid in a group, you obtain a lot of benefits too, about learning how to take turns, to learn to how to work in a team, share spaces, deal with frustration. So I think it's very important to also see the psychological and the social aspect and the benefit of that, the development of the person. It is very important. So those will be the 3 main ones.
Yes, you mentioned something so important, and in our program at Sporti Transforming Lives, we're into the youth development, and youth development we see based on 3 pillars: the pillar of social emotional learnings, the wellness pillar, as well as the physical activity pillar. So what you said is just totally I appreciate it a lot that it's not only on our side that we're thinking on the youth development importance of developing at an early age the 3 basic youth development pillars. So it's great to hear that an expert and a doctor and a physician as you are, with all your experience, can support the thoughts of promoting at a young age the practice of sports and in groups, because the social emotional learnings that come from it are for their lifetime. Mm-hmm.
Yes, totally.
Okay, well, we have one more question before we close. Any volunteers or courage raising hands? Betty, Rocio, Silverio, Diana, anyone that wants to ask something else? I think we covered all the questions. We will have, I do have more, and we can do another Zoom next time and in another week if you have time. and we can think about other topics that we can share with the community and educate parents. I will
Definitely.
gladly open our space and our community to share your experience.
Definitely, I would love to. And thank you, Sporti, and thank you, Sandra, for inviting me to be part of this today. Part of the key of medicine is preventive medicine, but the essential element of preventive medicine is education. So if the more education information we have, we empower ourselves and our community. So definitely, I'm very glad that you open up this space, and thank you for making me part of this.
Thank you, Dr. Lucia Salas. Thank you all the community and parents and families that joined today. And I want to share also as well that this is being recorded and it's going to be shared in a summary in our live, in our social media. And we are also we're also going to share it in our YouTube channel. So it's going to be there to share with more interested parents that want to learn from this. And I know that the repetition now in the social media and the digital world, it's what makes that impact a higher impact. So what we did today, we are a small community of parents together, but the number of repetitions of this video and this conversation, is going to have a bigger impact. I know it. And thank you. Have a nice night. See you in our next live. Thank you. Bye.